welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today in the show, we have Melinda Ring. She is an integrative medicine physician, and she wrote the Kevin MD article, 6 Unconscious Biases Against Vitamins and Supplements. Melinda, welcome to the show.
Yeah, thanks so much for having me.
We'll get into your article in a little bit, but first off, can you share your story and journey to where you are today?
So I'd say I grew up with an interesting perspective on health and medicine. My dad's a pathologist, and when I was growing up, I used to go with him on the weekends to help him out with autopsies. And when we would do that, I got an obviously really strong connection to the body and how it changed in death, but also this profound sense of what else was missing, that there was something other than the physical, you can call it spirit, that also changed between life and death. And then in college, I started out majoring in Buddhism and Eastern religion, and then halfway through switched to cellular and molecular biology, just kind of continuing this east-west path. And after completing my internal medicine residency at the University of Chicago, I did an integrative medicine fellowship. And since then, I've been on my way. Since 2007, I've served as director of the Osher Center for Integrative Medicine at Northwestern University, where I see patients and teach and do research. And really, I'm trying to push the needle forward on integrative health.
Now, tell us a little bit more about your practice, some typical cases that you see, and perhaps a typical workday.
Well, my workday is pretty varied. I like to do a lot of things. So I do quite a bit of teaching culinary medicine and teaching integrative medicine, trying to train that next generation of health providers to know about those things. In my clinical practice, I only do consults at this time. And so I get referrals from physicians where their patients are seeking things other than conventional biomedicine or things to help complement what they're doing with their other care. So a lot of people come looking for things like which natural product should they be taking, what diet is the right diet for them, what other things like from other healing traditions like traditional Chinese medicine, Ayurveda, mind-body practices might help complement their care and help them get to their goal. So it's a really rewarding practice. I see patients with all conditions and those interested in prevention or just in again, trying to feel better.
Now, what are the most common conditions that other physicians would send patients to you for?
My practice is very heavily women's health based, and I specialize in hormonal disorders. So I do see a lot of women who are having perimenopausal issues and thyroid type concerns where they're just not feeling like they used to. But there are also, everything from oncology patients who are trying to mitigate some of the side effects that they may have from chemotherapy and radiation. Patients with conditions like fibromyalgia, chronic fatigue, and other things that our usual care just isn't that good at treating. And so, a lot of people will come and get referred by their physicians where they feel like they're just out of answers. And are there other things that can give them hope that they might feel better?
All right, let's transition now into the Kevin MD article that you wrote. It's
Sure.
titled 6 Unconscious Biases Against Vitamins and Supplements. Now, for those who didn't get a chance to read that article, can you just walk my audience through it and share the story of why you decided to write it?
Yeah, sure. So I teach quite a bit about, and include in my clinical practice, quite a bit about natural products. And one of the most common themes that I hear from my patients is that they have been told by their doctors that there's no need to take dietary supplements, that they're dangerous, that they're always adulterated, that they're not regulated, that there's no need to take supplements. You can get everything through your diet. And so I was just moved to try to bring awareness to our medical community about some of the biggest myths that are out there about dietary supplements that they just may not be aware of.
All right. So what would you say are some of those most common myths?
Yeah. So the ones that I went through in the article. So the first one was if it mattered, I would have learned it in medical school. And we know that nutrition and natural products and these sorts of things there's just not enough time given to them in medicine. I probably had at most an hour lecture on vitamins and supplements, and that's due to the pressures of how much we have to learn in medical school. But I think it leads to this feeling that then it doesn't matter to somebody's health. The second one is that this false glamour of pharmaceutical drugs and FDA approval. And this is, again, something that's heard a lot, like, oh, dietary supplements are unregulated. But in fact, there is regulation through an act called the DSHEA Act, which is the Dietary Supplement Health and Education Act. And through it, there is FDA and FTC oversight of natural products. Now, it is very different, and it's considered at a different level than pharmaceuticals or over-the-counter drugs even. You don't need the phase 1, phase 2 trials before a dietary supplement is put on the market. But in fact, there is regulation, and there is research that's happening that shows the benefits of some of these things. So that is number 2. The third one is a big one, and that is we can get everything we need from our diet. So we don't need dietary supplements or vitamins or anything. And, I don't know about you. I mean, I teach about this stuff. I try to practice what I preach, but I know my diet is far from perfect. Studies like from the NHANES, which is the National Health and Nutrition Examination Survey in our country, shows that up to 94% of Americans fail to get the recommended daily intake of certain nutrients. And so I think, again, this idea that if you eat a healthy diet, you don't need supplementation is just a huge fallacy. And we're doing our patients a disservice. Add on top of that the fact that so many of our pharmaceutical agents deplete the body of these nutrients, that so many people have digestive issues and may not be absorbing them well. And I think it's the rare person who actually is getting everything they need through their diet. The fourth bias is if I can't see it, it doesn't exist. And, I have not had a patient walk in my door with scurvy or rickets. And so there is kind of this idea that, well, if somebody doesn't have these overt symptoms of nutrient deficiency, that there's not a problem. But we know that, even if you think about something like iron deficiency anemia or iron deficiency, there can be iron deficiency before there is anemia. It's a process. It's not like we go from being fine to being not fine. And the reality is that some of those earlier deficiencies before there is a full clinical manifestation can still wreak havoc on the biochemical processes. These nutrients act as cofactors in our enzyme reactions and other things. And so again, I think this idea that if you don't have the classic syndrome, there's not a problem is another myth. The fifth bias is don't ask, don't tell. And this is just the reality that, again, we are more prone to send our patients for expensive tests, evaluations, procedures than to do some slightly beyond the normal, the typical evaluation for deficiencies. And, I think probably, vitamin D has gotten popular to check. B12 will get thrown in there when somebody complains of fatigue or an iron panel, but that's pretty much it. And we have so many more vitamins and minerals that can be checked. And so I think sometimes going a little bit deeper can really help uncover problems. I see it all the time. And then the last one is the illusion of scientific rigor. And that is, this is not only an issue with dietary supplements, but it is this, what I see happen is that a study will get published. Fish oil is not good for X disease. And then this gets blown up in the news or in medicine as therefore there is no benefit to fish oil, which then discards the data that shows that fish oil has been shown to be helpful for example, rheumatoid arthritis and ulcerative colitis. And so there is this idea that, we have to learn not to generalize one scientific finding to all disease, all patients. And so those were the ones that I went through in that article, and hopefully it helped open some minds into the fact that it's worth taking another look at natural products and dietary supplements for our patients.
One of the areas of pushback that I get whenever I talk about supplements, I guess, relates to your sixth bias, the one about scientific rigor and how some supplements don't have that gold standard of randomized, double-blind, controlled studies that back up a lot of these supplements. Now, what's your thoughts on that? And can you comment on that line of criticism that I often hear about?
Just historically, let's say, natural products have been used in many cultures for thousands of years. And I think the double-blind placebo-controlled trial is what we should be doing for many of these natural products, compared to, let's say, suggesting that a patient go get a massage or meditate. There is an inherently greater risk associated with using natural products. They're active agents. That's why we think they work. But that means they can also cause harm. It is a problem in the field because many times these products cannot be patented, that we don't have the big engines of pharmaceutical companies behind funding the studies like we do with our usual medications. That doesn't mean they shouldn't be done, but it is the reality. The NIH division, the NCCIH, National Center for Complementary and Integrative Health, is one of the organizations that is helping fund some of that research. But we do have a long way to go. So I don't disagree with the fact that we need more research in this area. I think that is true. However, there should also be a recognition that oftentimes when you're using these supplements, that the inherent risk is so much less than the pharmaceutical drugs that we use. Even I had put this in my article, if you look at the reports on reported harms through the FDA advanced event reporting system, that, there are almost 2 million reports of adverse drug reports. And out of those, less than 200 were related to dietary supplements. So I think, yes, we need more data, and we should stop blowing up the potential risk because it's relatively low compared to the pharmaceutical drugs that we recommend to our patients.
When you discuss integrative medicine in articles like this, in general, do you get any pushback from your non-integrative medicine physician colleagues?
I, have been called unscientific or anti-scientific by some of these kind of quack watch agencies. So yes, I have certainly been on the receiving end of that. I think, again, those are from people and organizations that are just anti any change to the current standard of practice. For the most part, all of my patients are referred by physicians, and the reality is, I think, as most physicians go through their practice, they start to see that there is a lot still missing in medicine to provide the care that our patients need. And so more and more, I see doctors as patients. I am referred to, my referrals for patients come from other physicians in cardiology, oncology, et cetera. I think in integrative medicine, as long as we can bridge that language and help realize that there is science behind what we're doing, there is thought behind what we're doing, and that it is always in the goal of taking the best care of patients, that hopefully integrative medicine will gain greater acceptance and will overcome some of that negative view.
You work for an academic medical center, and I know other academic medical centers also have integrative medicine departments like the Cleveland Clinic and Duke, for instance. Now, do you see this becoming more of a trend going forward where traditional academic medical centers are partnering or starting up their own integrative medicine divisions?
I frankly think we've reached that tipping point. There's Northwestern is a member, and I'm a member of the Academic Consortium for Integrative Medicine and Health, which is the corollary to, say, the ACP for internal medicine. So it is the organization that represents academic centers with integrative medicine programs. There's well over 70 organizations that are part of that. So really most major academic centers across the country have integrative medicine available in some form or another. I have a lot of integrative medicine is practiced in the community. For me, it's been a choice to stay within academic medicine because I think we need to create change from within medicine. I think we're going to see it more and more, and hopefully that's going to help increase its acceptance as a valid form of care.
We're talking to Melinda Ring. She is an integrative medicine physician, and she wrote the Kevin MD article, 6 Unconscious Biases Against Vitamins and Supplements. Melinda, for those primary care clinicians who may be listening to this podcast, when should we start thinking about integrative medicine approaches when we see patients in the exam room? Are there any specific conditions that should lead us to that integrative medicine approach? Should we refer healthy patients to integrative medicine? So what are some common scenarios where we in primary care should think about an integrative medicine solution?
I am personally biased. I think every patient can benefit from an integrative medicine approach. The goal, frankly, in the field is that most integrative medicine will just become part of medicine. So if, for example, a supplement works or acupuncture works, it should be part of standard treatment plans, and all primary care doctors should be comfortable doing that. At this point, I would encourage primary care and specialist physicians to identify others and physicians in the community that they do feel comfortable collaborating with. And then for those patients where they either, number one, the patient's expressing an interest that where the primary care physician doesn't feel comfortable, they're saying, well, the patient's asking me about using valerian root, and I have no idea because we never covered that in medical school. If a patient's expressing interest, it's a great idea to get an integrative physician involved so that the care can be overseen. And if we know patients are going to use these things, let's have them use them safely and with good oversight. The second area is those areas that I talked about where, we just don't have good pharmaceutical or interventional approaches, things like irritable bowel syndrome, chronic fatigue, fibromyalgia, chronic pain syndromes. Let's move away from opioids and pain medications to trying to help patients. And then certainly when patients express any interest in holistic approaches, it's great to have a resource in your own community where you feel comfortable referring a patient rather than them having to seek it out on their own. And I will say, I will encourage people, there are now integrative medicine trainings for faculty. There's conferences available on nutrition or on dietary supplements or just on integrative medicine in general. So go for your continuing medical education and learn more about it yourself so that you feel more confident either incorporating it or making appropriate referrals.
Now, you're internal medicine trained, but there are a lot of integrative medicine clinicians with significantly less training or more variable training. So when looking for an integrative medicine clinician, what kind of qualifications should we be looking out for?
So integrative medicine is considered, number one, it's a fellowship level training. So realistically, in the reality of things, if they have completed an integrative medicine fellowship, they have already completed their primary training, whether it's pediatrics or family medicine or surgery or emergency medicine, and then gone on to do integrative medicine training. Unfortunately, people in the community who will label themselves as integrative or functional medicine without having done a full fellowship training. And so I would say that there is now a board certification for integrative medicine. I'm actually on the board, which is the American Board of Integrative Medicine, that's offered through the organization ABPS. And so looking for a board certified integrative medicine physician guarantees that they at least meet a certain level of quality, knowledge, ethics, et cetera, and have completed a fellowship training.
And my final question, what's your take-home message that you want to leave with the Kevin MD audience?
Well, my take-home message is this. I would say, as said the Zen monk Suzuki, that in the beginner's mind, there are many possibilities, but in the expert's mind, there are few. Where there is so much divisiveness in the world, we don't need to be on different sides within medicine. And I think if we can all let go of ego a bit and allow ourselves to be curious, and come to this idea of the beginner's mind, the idea of first listening without preconceived notions and judgments, that we will do a better job of healing ourselves and our patients.
Melinda, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thanks so much, Kevin.